What do employers really want to know about you? When you're a nurse, it can be hard to know how to prepare for an upcoming interview. I'm Alexa Davidson, an RN with over 10 years of hospital experience. In this video, we're going to discuss the top 10 nursing interview questions and provide example answers. Be sure to stick around to the end, where we'll share a tricky question that is very common for nurses to be asked. It seems deceivingly simple, so stick around and you won't get caught in its trap. Question number 1. Tell me about yourself. Interviewers often begin with this question to ease into the conversation. Don't just summarize your resume or daily responsibilities. Aim to connect with your interviewer and describe your big achievements. A great strategy is to refer to your origin story, in other words, your childhood, and make a quick link to your career goals and what motivated you to enter the nursing field. Here's an example. I always knew I wanted to work with kids. This inspired my specialization when I went into nursing. Now I have about 12 years of nursing experience, most of which are in pediatrics. As a new grad, I worked in an adult med-surg trauma unit. I was then able to transition my care from adults to pediatrics by transferring to the PICU. After almost 2 years, I advanced nursing specialties to the pediatric cardiac ICU. Here, I was able to take care of some really high acuity patients. We took care of all 3 stages of single ventricle repairs. After working in the PCICU, I became a travel nurse and worked in all different hospital settings across the country. Now I'm ready to settle down into a full-time PICU position where I can continue to grow as a nurse. If you'd like to learn more about how to answer this common question, we have an entire video devoted to the topic that we'll link in the comments. Before we move on, if you've watched this far, let us know by giving us a like, subscribing, and hitting the notification bell. Question number 2, why do you want to work here? Hiring managers want to know that you've done your research about their facility and that you're genuinely interested in being a part of their team. They want to hear that you're open to learning, not that you know everything already. Show your interest by talking about how their facility will impact your nursing career. Here's an example answer. I'm interested in working in this PICU because I want to expand my skill set as I prepare to one day become a family nurse practitioner. I know that you are a specialty center for rare diseases, particularly oncology, and I think this will help me learn about some of the possible health trends in the community that I may be treating one day. I noticed that you ranked in the top 10 best children's hospitals in the nation last year, and I'd love to be a part of a team that maintains that standard. Question number 3. What are your career goals for the next 5 years, and how will this position help you achieve them? Interviewers often ask this question to determine whether you're a fit for the facility and the unit. The best way to prepare for this question is to learn about the mission and culture of this workplace. For example, if you're interviewing to work at a teaching hospital, there's a good chance you'll be expected to contribute to a culture of learning. You'll want to express interest in joining committees that help elevate their standards of care. Try to mention the aspects of the company that appeal to you and how this role aligns with your career goals. We have a great video that explains this, which you can check out right here. Let's see an example. Once I get off orientation, I'd like to get involved in the unit by joining some sort of quality improvement committee. I was a central line infection prevention champion at another hospital, so I could see myself helping with CLABSI prevention here. After about a year, I'd like to start getting signed off on my PICU advanced competencies. Once I've done that, I could see myself doing a research project to get my clinical nurse 3 status. Long term, I'd like to take all of that experience and go on to NP school to become a family nurse practitioner. Question number 4. Describe a time you had to come to a compromise when working with others. Nurse managers want to know that you're a team player. They want to hear that you work well with others and that you are willing to compromise, especially when patient safety is at stake. Here's an example. I once worked on a quality improvement project in the PCICU, which was created to revise our standards of care for parent involvement for infants post-cardiac surgery. A teammate and I were interested in implementing protocols that would allow parents to hold babies sooner after cardiac surgery. A few team members were not comfortable with allowing parents to hold babies who had invasive lines and tubes. So we presented the evidence from other cardiac ICUs that had been successful with early parent involvement after heart surgery. It took a lot of discussion, but ultimately, we were able to come to a compromise, which allowed parents to hold babies with intracardiac lines, but not ET tubes after surgery. Question number 5. Give an example of something you've done or supported that brought a positive change to your work area. Not only do hiring managers want to know that you're open to change, they want to see that you're willing to take part in positive change for the unit. Managers like to hear about a committee you joined and the results of a project that you worked on. They are looking for insight into how your contributions can impact patient care if they hire you. Let's see an example answer. When I was working in a PICU a few years ago, we had an incident where a patient with a trach had an emergency and the correct supplies were not at the bedside. I joined a committee to put emergency trach caddies at the foot of the bed for every patient with a trach. I worked with different disciplines, including respiratory therapy, pulmonology, and the medical team, to make sure we all felt comfortable with the supplies in these kits. A year later, we were able to see a significant reduction in incident reports related to trach emergencies. Question 6. What type of situation at work has caused you stress? What did you do to overcome the stress? It's important to have a clear explanation of how you handle the emotionally and physically demanding aspects of your job. To answer this question successfully, describe the techniques you've developed for stress relief. Think about a time you faced a stressful situation and describe what you did to avoid becoming overwhelmed. Here's an example answer. I can recall a time that I floated to the NICU and was given a 4-baby assignment. I was concerned about how I would manage my time between 4 patients when it's typical to only have 3. During report, all I could think about was how overwhelmed I was and how I'd get through the shift. So after I got report, I took a minute to myself and did a 4-7-8 breathing exercise that I used to help get through stressful moments. I reminded myself that these patients were stable and they wouldn't be in an assignment together if they were really sick. I changed my mindset from how am I going to get through this to I've got this. I'm a competent nurse and I wouldn't be asked to take this assignment if I couldn't handle it. Question 7. Explain a situation when you provided patient education and what was the outcome. It comes with the territory, but as a nurse, you likely have to explain some complex medical terminology or care instructions to your patient or their family. Because of this, it's common for a nurse to be asked this behavioral interview question. In these instances, use the STAR method. Describe a specific situation, your task, the action you took to address it, and the result you achieved. Here's an example answer. I once took care of a baby who was having difficulty getting off of tube feeds and had an NG tube that had been in for months. The medical team approached the parents about placing a G tube, and they weren't so sure about it. As the nurse, the parents came to me and asked what they should do. I explained to them the benefits of getting a G tube and how it would make their daughter's life better. To ease their fears about surgery, I explained the process to place the tube and what the recovery would look like. Once I cleared up all of their questions and misunderstandings about the procedure, the parents ultimately decided to go forward with the G-tube placement, and their daughter was discharged home much sooner. Question 8. Name a time you had a conflict or disagreement with another staff member. How did you resolve it? As a nurse, you'll interact with so many stakeholders. These could be other nurses, doctors, or other healthcare professionals, and you all want to do what's best for the patient. When asking this question, hiring managers want to know how you may approach conflict in the workplace. Your response should provide insight into your personality and indicate how likely you are to function well within a team. Past behavior often shows how you could react to similar situations, so be sure to provide an example that you are proud of or explain the lesson you took away from the experience. It is important to emphasize the resolution that took place, as opposed to dwelling on the conflict itself. When you answer this question, emphasize your interpersonal skills, such as active listening, teamwork, flexibility, and the ability to follow the chain of command when necessary. Here's an example. There was a time that I was admitting a patient with sepsis who needed a lot of tasks to be completed right away. I had a plan for the order in which I wanted to complete them. The physician came into the room and wanted to know why certain meds hadn't been started yet, and I could tell she was growing impatient with me. At first, I was feeling frustrated, but I took a step back and realized the issue here was that the two of us were just not communicating. The physician needed to know that I had everything under control, so I verbalized my plan. I politely responded with the order in which I planned to carry out the tasks and asked, "Is there anything you'd change about that plan?" This let her know that I was on top of things, but I was also open to feedback. Ever since then, we've worked well together, and I've made sure to use closed-loop communication when admitting patients and discussing the plan with the provider. Question 9. Tell me about a time when you had to deal with a patient that was upset. How did you handle the situation? As a nurse, it's important to have compassion and patience. When asked this question, consider giving an example of a time when you encountered a difficult patient and helped to improve the patient's outcome. Make sure to mention if you provided extra resources that help make the patient more comfortable. Here's an example. While working overnight in the PCICU, I had a 15-year-old patient who was going for heart surgery the next day. The patient called me into the room several times within an hour with various concerns. Even though I was falling behind on my scheduled care of other patients, I sat down with him to ask what he was feeling. It turned out that he was worried about surgery and just was not used to being away from home. I spent a few minutes asking about his pets at home, and I even arranged for the pet therapy dog to visit him after surgery. After that, he went to sleep and no longer called repeatedly during the remainder of his stay. This situation helped me learn to look beyond patients' attitudes for underlying concerns. Question 10. Why should we hire you? I know what you're thinking. This seems so simple. Why would I say this is the trickiest question to answer? Most people are fooled by the apparent simplicity of this question, but selling yourself as the best candidate above all others isn't always easy as it seems for a nurse. In reality, your education, experience, and qualifications might look identical to other candidates on paper. So what makes you special? Nurses are so used to putting the needs of others first that it can feel out of character to put yourself first. To answer this question successfully, you should address the unique skills and experiences you offer and share why you're a good culture fit. Let's take a look at a sample answer. I'm passionate about pediatrics and making a difference in the life of kids. I know that being in the hospital is a scary time, and if I can make a patient and their parents more comfortable, then I know I'm in the right place. I think I'd be a good fit for this unit specifically because of the experience I will bring from having been a travel nurse in a number of different settings. I've established a strong foundation for peds cardiology and trauma care, but I'm excited to learn about the specialty diseases you treat at this facility. I really value the teamwork and culture of learning that I've noticed in this PICU, and I would love to be a part of that culture of excellence. I hope you found this information helpful and that you're able to apply it as you prepare for your next nursing interview. Let us know you like the video by hitting the notification button for more career advice, and you can subscribe to our channel right here. For more information on interviewing best practices, I recommend checking out this playlist. And for advice on which weaknesses to share in an interview, check out this video. Thank you so much for watching. See you next time.